Now, this deformity is called the swan neck deformity. Now, this swan neck deformity is actually the reverse of Botaniers deformity. So, if you remember the joint positions in Botaniers, then you have to just make it reverse here. So, there it was extension at MP joints, that's metacarpophalangeal joints. Now, here you are going to have is flexion at these joints, metacarpophalangeal joints. In Botaniers, there was hyperflexion at PIP, but in swan neck deformity, there is hyperextension at PIP. In Botaniers, there was extension at DIP, distal interphalangeal joints, but in swan neck deformity, there will be flexion at DIP. So it's just the reverse of Botaniers, and this is called swan neck deformity. Why is it being called swan neck? Any guesses? Think about this thing. This is how a swan is. The neck of the swan is, which has anterior convexity in the middle of the neck. Just remember this. And this is how the swan neck deformity appears in a subject. This is swan neck deformity. Flexion at metacarpopharyngeal joints, hyperextension at PIP, and then flexion at DIP. Now, this you're seeing is also a swan neck deformity. Let's talk what actually is the cause of this swan neck deformity. One thing you should know that what the knuckles are, these are the head of the metacarpals. What's this? This is the proximal phalange. What is this? This is middle phalange. And this one is the terminal phalange. Right. Now, the prime reason for this swan neck deformity is the separation or a gap created between the two lateral slips of flexor digitorum superficialis. You remember this muscle, flexor digitorum superficialis? It was crossing the metacarpophalangeal joints, then crossing the middle phalanx, and then crossing the proximal IP joints by splitting on its two sides in two lateral slips. And that's how the two slips together join to insert on the palmar aspect of the base of the middle phalange, and thereby it creates a hole here, a gap, just like the buttonhole deformity I just told you. So remember, this PIP, proximal interphalangeal joints, is having two buttonholes, one on the dorsal side, and that was by the two lateral slips of extensor digitorum, and on the palmar side there is a gap created by this tendon of flexor digitorum superficialis. But this gap is not a weak gap, because there is this another muscle which is running deeper to flexor digitorum superficialis. It was also crossing the metacarpophalangeal joints, then it crosses the PIP joints, and then emerges in between the gap created by the two slips of flexor digitorum superficialis and inserts onto the palmar aspect of the base of the terminal phalange. So this muscle is flexor digitorum profundus, a deeper muscle. So the tendon of the flexor digitorum profundus is embraced by the two lateral slips of flexor digitorum superficialis just in front of the PIP. This is PIP. Now, this deformity, as we're talking about, why does this swan neck deformity happens? Because of the separation of these two lateral slips of flexor digitorum superficialis. Lateral slipping of these two slips, providing a gap. So when there is a gap created, obviously, and people who are like maybe professionally in their occupation, they're involved in such work where they have to hyperextend their digits, and mostly because of this rheumatoid arthritis, because of the imbalance between the musculo-tendinous pull on different adjacent joints. So that leads to, this weakness of this tendon on the palmar surface, flexor digitorum superficialis, and through that gap between the two lateral slips of flexor digitorum superficialis, this PIP may pop out on the ventral aspect, that is the palmar surface. But this is not so much prominent, unlike the buttonhole deformity. The facts you have got to know now: this is metacarpophalangeal joints, where you find is flexion, and at PIP there will be extension, and at DIP it will be flexion. Remember this now, at PIP, if there is extension, that is swan neck deformity. This is swan neck deformity. And if there is hyperflexion at PIP, that leads to Botaniers or buttonhole deformity. Now, here you're seeing is a tri-point splint. This is used to treat swan neck deformity. The purpose you can see here is to prevent the extension at PIP. This is another similar splint used to treat swan neck deformity. Remember, the purpose is to prevent extension at PIP.